Yeah. So I generally I usually reevaluate the tissue after 24 hours. But quite often it seems that the quality might improve. Sometimes it will go worse also. So I don't know what exactly is happening, but sometimes it becomes better, sometimes it is worse. Okay, so the topic Hilda has given me is to beat the defeat. I would say we have been defeated so many times. I don't know whether I'm capable of telling about how to beat the defeat. So this I'll skip. Corneal diseases form the second major cause of blindness in the developing world. It's the estimates of blindness varies from whichever studies you look into, but the projected estimate is close to about 12 million, and about 275 million have vision loss. So this interesting study, the National Blindness and Visual Impairment Survey conducted by multiple centers from 2015 to 2019 found that the blindness has reduced from 1.4% to 0.36%. The original target was 0.3%, but we are very, very close to the target, which is really commendable. So the cooperation of the private and the public sector to work in these lines for this NPCP, that has really worked well. And we should understand that cataract is the major cause even now. But we now very well know that the cataract surgical coverage is close to 94%. Cataract surgical cover means a number of people who require cataract surgery who can access the services. So if 100 people require surgery, 194 people are able to avail the opportunity in a country like India, in which the financial constraints are very much there. So that is really commendable. So now it is the opportune time to look beyond cataract and look at other pathologies. So the most prominent pathology that we have is the corneal pathology. So corneal blindness, as people have multiple times mentioned, that it is about 0.545% of the population in people more than 50 years. And in people between 0 to 49 years, it is 37.5%, which is the most common cause of morbidity. In the rural scenario, the situation is slightly more. The corneal blindness is 0.55% and bilateral blindness is 0.12%, which is really, really significant. So I'm not going into the details of the eye banking. Hilda has very beautifully mentioned about it. So before 70s, it was limited to Gujarat alone. But now we have about 740 registered eye banks. So a sea change has happened after the 70s. I think a lot of it happened because thanks to the institutions like Aravind Eye Care System, Shankar Nethralaya, LB Prasad Eye Institute, who revolutionized this field in our country. So at this point of time, we require about 270,000 donor eyes to perform about 100,000 transplants every year. This I made a mention, NPCB, we were the first country in the world to launch a national program to reduce the blindness, and we have almost achieved it. But the interesting thing about the eye banks is that the 2% of eye banks constitute to about 70% of the collection, which means that a very significant percentage, 90% of them are non-performers. With the coming together of SideLife and EBIA, things have improved better. But India as a country needs better infrastructure. Even though the infrastructure and readiness is high, it needs a strong nodal system and a monitoring agency to really take it forward. So if you look at the eye collection numbers, the maximum possible collection which was happened in India is in 2017-18, 71,709. And utilization was about 26,682. If you look at the last year, the collection was 45,008, almost 46,000, and the utilization was around 28,000, 61% utilization. So we have really come a long way. I think there are about 500 active corneal surgeons in India. I think Corneal Society, Binay must be knowing better, has close to 1,000 people. So if every surgeon does 100 cases a year, easily all the corneal blindness can be taken care of. But I think the transplants are limited to few major institutes. LB Prasad runs about 4,000 per year. I think I'm talking about the Hyderabad Center. I think tomorrow they are having a program because they have completed 50,000 transplants. Aravind are having 1,400 per year. Shankar Nethralaya around 650 to 700. So certain centers are doing exceptionally well, while most of the other centers are not doing well. So why are we doing transplants? So I think if you look at the image, you can see that it's predominantly infections even now. Even though the infections have plateaued after, say, 90s and all, but still it is the predominant cause of the transplant. The other major causes are endothelial disorders, which is steadily going up. The number of regrafts have taken a dip after the coming into prominence of DSEK and DMEK. So regrafts, the numbers have reduced. Corneal scar also, it appears reduced. Maybe it is related to the better financial circumstances that we have, while others are almost same. So even now, infections and scars take a major role. So in general, voluntary eye donation, it is seen that in India, the utilization rate is about 20 to 28%. In HCRP, it is about 50%. In the largest eye bank in Asia, that is Ramaiah International Eye Bank attached to LV Prasad, it's about 70% HCRP. In LF, I believe it is 35%. So that is regarding the gross numbers. When you say GDP of India is great, you have to look at per capita also. So we should look, when we look at the corneal transplants that is happening in every million population, the global average is only 10. 10 transplants are happening for a million people. In India, it is about 23 million. While in US, it is close to 199 per million. That is very, very high. While in Europe, it is around 55 to 75. So most of the developed countries, it is between 55 to 75. That is most likely the figure we should be looking at. And India, we have almost half of it, less than half of it. And regarding the procurement, we have become much better, but the global average is 25 in million, and India is about 30 per million. So we need a fourfold increase in the procurement. We need a fourfold increase. So India is ranked as almost sufficient, ranks second to US in the numbers, both in procurement as well as transplant. This is a gross map of the world in which India has reached the green category in which it is almost sufficient. But if you see US and if you see Sri Lanka, which are blue, they are mass exporters. So we should think of that because the resources that we have are tremendous. So the small story that I have regarding the Amrita Eye Bank, I think we started in 2011. In 2012, with all Josh, I started the HCRP and found that a lot of people, most of the corneas I could not utilize at all. So utilization was only 27%. So the reason why, so I was looking at it, so most patients were on ventilator because it's an Apex Institute. People who are nearly dead only come there. So most of the tissues are damaged. And so which made me more selective regarding the donor selection. And then selective HCRP was done in that period. And so we used to collect about 50 eyes. So in 2018, we tied up with Saksham, which is a voluntary organization, which has a pan-India presence, which works on the field of disability. And then we started the voluntary eye donation. And there are people like him, Ramkumar Madathil, who was on his own, has motivated about 200 corneas to 200 people to donate their eyes. So over a period of 3 years, we are, last 3 years, we are consistently getting about more than 100 eyes every year. This organization, which started in Ernakulam, they are doing it in Kottayam also now, which is mostly given to Chaitanya Eye Hospital. I think few corneas in Cornea goes to Giridhar as well as the Eye Bank Association of Kerala, but I think Eye Bank Association is way, way ahead of us. In Calicut also, they have made in collaboration with the NIMS Hospital. So this is, I think Hilda has already mentioned about this. But if you look at star performers like Eye Bank Association of Kerala, I think they have retrieved close to 2,090 corneas and utilized about 984. And a voluntary donation is 670 and HCRP is about 314. And if you look at super performers like Ramaiah Eye Bank, they have, I think all the LBPI banks together, they have 10,000 tissues they do. I think keratoplasty numbers around 2,500 every year. And they have done a total of 35,000. I think tomorrow there is something which makes this landmark of 50,000 keratoplasties they have done in the last 35 years. So iBanks need a three-tier system. One is the iDonation Center, which can be attached to an iBank. I think this Little Flower Hospital Angamali has really demonstrated they have multiple iDonation centers which mainly work on HCRP, and this iBank has to. iBank is the place where we evaluate the tissue and distributes it to the surgeon. And we should have a few centers of excellence which can be iBank training centers. So I would, yeah, I think I'll take one more minute.
So it's okay, you can continue.
Yeah,
We don't
yeah.
have a discussion.
Okay, fine. So the main challenge, as Dr. Samar Basak was telling, is the data gap that we have. We have, I think, till my time of post-graduation, I've been learning that every year there is about 1 lakh backlog of corneal blindness that we have, and about 25 to 30,000 gets added every year. I don't know exactly where this information is from. Anyway, it is more than 25 years old. So if you look at only bilateral blindness, there is people less than 3/60 vision in even the better eye. If you just take that number, it is close to 4.2 lakhs. And we don't know exactly how many of them are transplantable. So they may be having vitamin D deficiency and a globe collapse, and they may be having a deranged posterior segment, in which case it is not working. So we do not have exact data regarding that particular thing in India. So the challenges in iBank is, I think what I mainly see is the statistics. Second is the socio-cultural perceptions, which have changed a lot in the last 20-25 years. Tissue supply again has improved. There is much more way to go. Tissue retrieval again has improved significantly with the incorporation of iBank technicians. There may be better things that you can do with policy support. Like if you have if you can notify the large iBank nearby that a death has happened, it will be something great, and no tissues will be wasted. And now I think we would have seen, people who are in the iBank field must be knowing, regarding the tissue distribution, there is going to be a national waitlist registry in conjunction with the iBank Association of India, NPCB, and the NOTO, that is the organ transplant and tissue transplant team. So this may become slightly unprofitable for the private iBanks. So we have to really work hard to make sure that we can exist. There can be some policy and advocacy from the government side also. For example, the Central Motor Vehicle Rules Amendment. Even now in the Kerala driving license, when I changed it, there was a question whether you are willing to donate the eyes, which is a step in the right direction. So I thank you so much for the opportunity once again. Hilda, it was a very good session, even though the attendance was not justifying that.
Thank you, sir. It was a very tough topic, the challenges to be faced, and sir has given a dramatic presentation with extensive statistics as well as the points